Good afternoon and welcome into Facebook Live. I'm Kelly Swoope with Dr. Zaheer Faizi from GBMC. It is a day of answers here today, and we are taking all of your questions on our Facebook Live feed about the flu. It has been a devastating year for it so far, hasn't it, Doctor?
Absolutely has. It's been a real tough year with the flu this year. We've seen a record number of cases that did not end well, and it's just been a very hard strain of the flu this year on people.
You know, we reported yesterday in the news that we actually had our first pediatric death from the flu somewhere here in the state of Maryland. Not exactly the age or the location of where it happened, but it did happen in the state. And up until then, we've been reporting across the country. I think there have been 58 cases of children that have died from the flu. This is serious this year.
Right, it's absolutely serious, and it's just more emphasis on why we need to get vaccinated on the flu and get more people vaccinated, because a lot of these children and these people who are elderly or have immunocompromised immune systems are just not able to protect themselves from the flu, as well as the younger, healthier people who can get vaccinated and can stop and decrease the spread of the flu.
All right, well, we're waiting for people to send us in some questions. I'm going to play devil's advocate here, Doctor.
Sure.
I have so many friends who, I started getting the flu shot when I was pregnant years ago and had my daughter, and I continue to get it to this day. But a lot of people say, oh, it's never guaranteed, it's not 100%. Why should I get the flu shot? Because this year they're only saying it's, what, 40 to 60% effective?
Well, so, you know, there's multiple strains of the flu every year, right? And we unfortunately got one this year that's a little bit tougher for the flu shot to be 100% effective against. I think the numbers are with H3N2, which is one of our more virulent strains this year. It's not as effective, but keep in mind there's other strains out there which it is effective against. Secondly, if you're pregnant, you should absolutely be getting the flu shot, because not only does it protect you and you have worse outcomes in pregnancy if you do get the flu, it also protects your baby for the first few months of life.
So should you, actually, we're getting some questions coming in right now.
Sure.
Several children have passed away, no pre-existing conditions.
You know,
That's from Lisa. Thanks for sending your question in, Lisa.
Thank you. No, so, you know, children necessarily don't need pre-existing conditions to pass away from the flu. Their immune system is just not always built up as strong as the adults, right? So they won't be able to fight back the flu as strong as someone who's 25 or 30 or 40, a healthy adult will be, and they're more susceptible to the complications because, you know, they are children.
If you haven't gotten the flu shot, is it too late?
You should absolutely get the flu shot. It's not too late to get the flu shot. You know, just want you to keep in mind, it takes about 2 weeks for the flu shot to fully kick in once you get it to protect you against the flu. So you should get it as soon as possible if you haven't gotten it.
Melissa Abel says, is it free to get the flu shot? Is it out of pocket or Medicaid? Most insurances cover it.
Most insurances cover it. You can walk into most CVS's or Walgreens that administer it at Minute Clinics, urgent cares. You can definitely come up to the GBMC. We have clinics there as well, and you can get the flu shot. It's usually covered by insurance.
Should you get it more than once a year?
You should not get it more than once a year. It hasn't been recommended. However, if you are an older adult over 65, there is a high-dose version of the flu shot. It has a little bit of a booster, what we call an adjuvant, so your body makes a stronger immune response towards it. And you know, that is recommended in someone who is over the age of 65, and it may or may not apply to you, so you got to visit your primary care doctor, and they can help guide you in that regard.
Now, as far as the length of flu season, I mean, shouldn't it be wrapping up soon, or?
So, you know, we're just kicking right into high gear with flu season right now. We're going December to about March is really where the peak is. And, you know, right about now, we're getting flu B, right, which tends to be a little bit worse, and it comes later in the season. So another reason why you should be getting your flu shot.
Shalissa Boyd writes in, she says, I got my flu shot in September of 2017. I guess I'm sure she's wondering, is it still effective now?
It is still effective now, yes.
Why is Tamiflu making so many people sick? I have the flu and they gave me Tamiflu, but it hurt my stomach badly.
Oh, okay. So, you know, here's the thing about Tamiflu, right? Tamiflu only cuts off about maybe a day or two off of your flu symptoms, but you got to get it real early. So right when you start feeling like you're not right, something's feeling wrong, would you feel like you're getting the flu, you got to usually get it within the first 48 hours for it to even be effective, right? That being said, if you're young and healthy, right, Tamiflu isn't really going to make a big change in the course, and you're probably going to have a milder version of the flu anyways.
Cindy is writing, and Cindy Berry saying, whatever happened to building up natural immunity? I was exposed to H1N1 and never got it, and never got a flu shot.
Sure. You know, before we had vaccinations, we used to get exposed to natural immunity, right? But we got to keep in mind in our society, there's people, elderly people, who can't fight the flu. There's younger people, children, for example. We're having a lot of pediatric deaths this year, which when they are exposed to the flu, they're just not going to have as good an immune response as a 20 or a 25-year-old. And we interact with those people on an everyday basis, whether it be our grandmother or our granddaughter. And to protect them, young, healthy people should definitely be getting the flu shot.
We actually had an interesting study out yesterday from the New England Journal of Medicine talking about people more susceptible or vulnerable at a risk for heart attack with the flu.
Yeah. So, when you get the flu, one of the complications is you can get a bacterial pneumonia on top of it, or what we refer to in medical terms is you can also get sepsis with it. That puts incredible strain on the heart. And as you get older, if you're 65, 70, 75, and you're much older, that kind of pneumonia can really be a life-altering or a life-ending event for you, and it can put an incredible strain on the heart.
Yeah, they talk about the fact that if when they say compromised immune systems, we talk about people who may have cardiovascular disease,
absolutely,
or emphysema or asthma,
right? Or people recovering from cancer, for example, right? Or people who are older, who are just not able to build up the same levels of immune protection, or babies under 6 who can't get the flu shot because their immune system is so new, right? Babies under 6 months, they cannot get the flu shot. To protect them, we should be getting the flu. Again, like I said, if we're pregnant, to give them some protection the first few months of life, we should also be getting the flu shot.
You'll love this question, Doctor. The only time I've ever had the flu was the 1 year I got the flu shot. My mother and brother both always get sick after getting the flu shot. Are we allergic to the flu shot?
So that's actually a very, very interesting question that has come up a lot. So keep in mind, when you get the flu shot, right, you're getting injected with a bunch of proteins that your body is going to have a reaction to, right? And so for some people, you're going to feel a little bit under the weather for the first few days, right? And that's just your body gearing up to make some sort of response. So when you actually get the real flu, it's got all hands on deck, ready to go forth. So sometimes people do feel a little crummy after they get the flu shot. Doesn't mean you're allergic, right? Okay. It just means your body is doing what it's supposed to be doing. It's making the response you need it to make. And when you get the actual flu, it's gonna really go after it. Now that being said, I also want to keep in mind the shot takes about 2 weeks to kick in, right? So you can get the shot and still get the flu 4 days later. Your body just has not had the time to respond yet to the shot. So that's why it's essentially very important that you get it as early and as soon as possible. And if you haven't gotten it, I would recommend going to get it today.
Susan asks a very, very good question. She says, have most of the people who have died had the shot? Also, I had pneumonia and the shot too. Will that help stop the flu going into pneumonia? And I'm sure you can't answer the question about the people who have died, because that's going to be something for the CDC that they'll be looking at.
Absolutely, and those are individual cases, and there's many factors in those. If you do get the flu shot, studies do show that you will have a less likelihood chance of developing into pneumonia and developing into possibly an intensive care unit stay, and you will have a milder flu. So yes, it does make you less likely to have all those adverse events if you do end up getting the flu shot.
Yanni says, if someone with the flu is being cared for at home, what should they do, and how can they avoid transmitting it to others? What is considered a close contact? That's a good question.
Right, that's actually a very good question. So first things, hygiene. There's lots of hand washing that needs to happen. Keep in mind the flu spreads through respiratory droplets, which is basically coughing, sneezing, right? So cover your coughs, cover your sneezes, right? Wash your hands. If you're going out, wear a face mask. If you're caring for someone at home, I know it's sometimes hard to wear a face mask around loved ones, right? But just keep those things in mind: hand washing, respiratory hygiene, cover your mouth, cover your nose, and don't go to work until your fever from the flu has gone down for at least 1 whole day. That would be a pretty safe recommendation. And after that is when you go to work, and so you're not spreading it to your colleagues.
Yeah, and don't put those face masks down, because I tell you, I went to the emergency outpatient care not too long ago, not an emergency room, for a problem with my wrist. No flu, no nothing, and I put on a face mask just to protect myself from the other people in the room.
Absolutely. And if you can avoid going to the hospital, into the emergency room, avoid it, because people there, we've got the flu. We're dealing with an epidemic across the country right now.
Someone asked, people need to stop saying I got the flu because of the flu shot. Well, you're right, Kathy. That's right. You don't necessarily get the flu from the flu shot. You may feel a little soreness on your arm because of the shot, but not necessarily. So he says, what if one child has the flu and the other didn't get it if they didn't get the flu shot? CC Allen wants to know.
Oh, okay. So if one child has the flu and the other one doesn't have it, you should get them the flu shot first off, right? If they don't have the flu shot, and again, all we can do is respiratory hygiene. We wash our hands. We can put on a face mask if necessary to avoid contact. I know sometimes that's very hard to do with children, and telling a child to keep on a face mask is generally not ideal, but we can protect them by getting them the flu shot as soon as possible.
Cindy asked, if you get the flu shot now, can you still get it again in the fall for next year? That is twice in 1 year. That's a good question.
Right. Absolutely, because the way we deal with it, is flu season, right? So every fall we'll get a new flu shot where the CDC will study and say, this is what's going to be our prevalent strain coming out this year. So if you get one now, you're getting it for this year, right? And you can get another one next year to cover next year's flu season.
So you can get it in February and still get it in September, October for the next flu season?
Absolutely.
Tell us a little bit about how they predict the strain of the flu, because that's why some people are critical of getting the vaccine.
Right.
Well, it's never going to totally protect me from the flu. What do you say to those folks?
So, they use epidemiological data. They have lots of scientists who study lots of charts. And epidemiological is a huge word, but it's basically a fancy way of studying the statistics and studying what we're likely to get. And they study weather patterns. All those hurricanes that we had this year that moved and shifted our biome up and down is also part of the reason why we have a very, very strong flu season this year. And they have people who are spending lots of time studying this and deciding, hey, these are the most likely strains this year. And they don't always hit the ball, but usually they have a pretty good flu shot.
What about taking Zicam or some of the similar projects, Emergency or some of those other things? Could those help you or minimize the symptoms?
Sometimes it can help the person more than it can actually help the flu. It can be a little psychological, but Emergency, vitamin C, it can't hurt you. Zicam can't hurt you. But I would advise it, if you do have the flu or you feel it coming on, you have a fever, let it run its course. Drink lots of Gatorade, drink lots of soup, stay at home, don't infect your friends, your family. Cover your mouth when you cough, sneeze into your elbow, wear a face mask when you go out, those kind of things, and just keep it from spreading around.
Aaron wants to know what over-the-counter vitamins or medicines can help protect us if you don't have the flu. So maybe like as a preventative measure.
Sure. Some of that emergency stuff, multivitamins, they can keep your immune system going and strong. Vitamin C can help. But the first thing and first and foremost, I must harp on this, is you got to get that flu shot. That can help way more than any of those other things can.
Hand washing, you hear about that so importantly. You think about, you go to sometimes public places and all they have is cold water. Is that going to help kill off the germs?
Well, the cold water is not essentially what's going to help kill off the germs. It's a soap. So you use a little bit of soap, wash your hands for 20, 25, 30 seconds, and really rinse them off good. Get that soap in between your fingers, your digits, all of that, and that's what's going to help. Cold water, hot water, that once we have soap in the equation, it should be able to rinse all that off. And if you don't have access to that, carry around a little bit of Purell, a little bit of antiseptic wash, that something alcohol based, because remember, the flu can live on surfaces for up to 48 hours after someone sneezes or someone coughs. So if you come into contact with door handles, if you come into contact with things many people are touching, you might want to carry around a little Purell to help protect yourself.
All right, again, we're talking with Dr. Faizi from GBMC, taking your questions about this day of answers, trying to get down to this flu situation that's really gripping the country so seriously. How can you stay hydrated, Dr. Faizi, if you keep vomiting?
Right. So, first and foremost, if you keep vomiting over and over again and you can't stop vomiting, you should go to either your urgent care or your emergency department or your primary care doctor, because you don't want to get so dehydrated that we have other medical problems, right? But if you're vomiting once or twice, right, you can kind of relax, stay in bed, drink Gatorade, drink Powerade, anything that'll really help rehydrate you. Pedialyte's a good one as well, especially for children. You can go ahead, drink soup. But if you feel that you can't stop vomiting and you can't keep anything down, and it's been that way for 12 hours and you've vomited 5, 6, 7 times, you should probably go over to your emergency department where we can start treating you medically to help treat the nausea and vomiting and get you something down, maybe get you some fluids via IV so we don't get you to be real run down.
How do you tell the difference between a flu and a cold?
So, the indicator that I learned a lot of when I was way back in medical school was 101 degrees is usually the cutoff. If your fever goes above 101 degrees, you likely have the flu. If it's less than 101 and your symptoms are all up here, they're mainly, like a bronchitis, they're in your nose, you feel stuffy, that's usually the cold. But if you start getting muscle pains and aches everywhere, then you've probably got the flu.
Now, can you start with the cold and then it graduates with flu?
Yeah, and you can go the other way around too, and you can definitely get a cold. There's lots of them out there, and you can get the flu on top of it. Absolutely.
You hear a lot about disinfecting and wiping things down. The Clorox wipes, removing lingering germs. Does that really make a difference?
Oh, absolutely. When we wipe down surfaces, the medical term for the flu that lives on surfaces is called fomites, right? It's basically a fancy way of saying they have something there that can be there for about 2 days. Now, if we wipe that down, the next person that comes along and touches that surface will be much less likely to be exposed to what's there, as opposed to if we touch something where somebody sneezed, or maybe they sneezed into their arm, but it went a little bit further away. Every time we sneeze, it can go as far as 6 feet away. Right? So we want to be real careful to wipe stuff down. I mean, you don't need to do it incessantly every 5 minutes, but, if you get a chance, wipe things down, keep them clean, especially if you got young kids or you got elderly people in your house, which are more likely to have a worse outcome if they get the flu.
And that kind of ties into another study that was out recently about the breathlets that in the air. You can breathe the flu.
Absolutely. When people are around you and they're coughing, again, like I said, it can travel up to 6 feet away. So just in the distance that we are here now, right? If one of us was to have the flu, the other one can be exposed. It can go onto mucous membranes in the eyes, in the nose, in the mouth. So you want to be very careful if someone does have the flu to wear that face mask, especially when you go out and about.
Aaron says, what is the first symptom of the flu? Fever, works in a school, and she, obviously teachers and people there were dropping like flies.
Sure. Generally it's different for different people, but most people generally complain that they start to get muscle aches, and they don't feel like themselves, but they're achy all over the place, and that's how they generally know they're getting the flu.
Something else to think of, and you probably don't think of this, Cindy says it's probably a good idea to wipe down your steering wheels, your phones, and your remotes as well.
Right, absolutely, because, nowadays everyone's attached to their phone at their hip, and they take it everywhere, and every time you touch a doorknob, you touch your phone afterwards. You go in and out of your car, and you're touching all these things, whether you go to get some lunch at a restaurant, you have to think of all the other people that may have touched that same door handle.
Our four-legged friends are such an important part of our family. Lori writes in, if an infected person in the family pets the family pet, can the pet transfer the germs to other areas of the house and infect others?
Well, if someone is infected and they're in that infectious stage and now they've touched the family pet and the family pet walks around and we pet them, they absolutely can transfer it, right? And same thing, we got to protect our four-legged friends too. And we have to protect them from transmitting the virus back and forth. So, if someone is sick, stay in bed. Play with lasso tomorrow.
It's also tough, though, when you have that sick person at home and you're trying to take care of that person as the caregiver, but also not spread whatever they have to everybody else in the house.
Right, absolutely. And that's where, the Purell, the wearing the respiratory mask, the being very careful with your hygiene comes in big time. So if we're very careful to wash our hands, if we're very careful to wipe them down, if we're careful to wear a mask when we go and take care of our family member, we're much less likely to give it to other people. And again, like I said, if they get the flu shot, it protects them.
A lot of people say that we have to just let the flu run its course. I mean, I guess that depends on how long in terms of sick.
I mean,
a lot of people don't have that many sick days.
Right. And for a lot of people, the flu takes a few days to up to 2 weeks. And if you're in a young, healthy, don't have a lot of medical problems age group, right, generally you'll have a mild course and you'll be all right. The problem with that is if we go out and we expose others who can't let it run its course. For some people, the flu can be a very simple few days off of work. They have some soup, one of their loved ones takes care of them. But for some people, it could be an intensive care unit stay. And when we all get vaccinated, we really protect those people from getting it. It's the herd immunity concept. Right now, latest stats show maybe about 30 to 40% of people have actually been vaccinated so far for the flu. For herd immunity to work, we really need closer to about 70% of people to be vaccinated.
Can pets get the flu?
Pets get different strains of the flu. Right. I remember many years ago we had swine flu and avian bird flu, and it can be transferred over. There's too many different strains for me to really comment on that at this moment.
Now, are there kits or anything that you can have to, at home in terms of safety precautions or kits to protect yourself and your family?
Yeah, I mean, in terms of kits, I don't really know if the kits that are on the market for that, but Purell, face masks, all these things you can pick up at your local CVS or Rite Aid or drugstore. Make sure you practice good hand washing, especially with children. Get on them to wash their hands multiple times before meals, after meals. Everyone's on an iPad nowadays. Everyone's touching it left and right, and those things just become a beacon to transmit the virus, because you touch something, you touch the iPad, you touch something else, you touch the iPad, you wash your hands, and then you touch the iPad again. Right, or the iPhone, or whatever you're using all the time. So you got to really just keep washing over and over again. Make sure when you sneeze, teach kids to sneeze into their elbows, not into their hand or their wrist. Make sure when they're coughing, they cough into their elbows. That way, even if they touch something else, they're less likely to go forth and to help spread that virus.
Jennifer just joining us, asking a question. We kind of touched on this, but maybe we can go back to it again. The first symptom of the flu really is the achy.
Yeah, it's different for everyone, but for a lot of people this year I've been finding it's been the achiness, the muscle aches where they just don't feel right and they know something has come on, and then they get the coughs, the sneezing, but generally the muscle aches are a big differentiator for the flu versus the cold.
Kira has a really, really good question.
Sure.
She says, my son currently has the flu. What should I look for to know if he's not getting better and needs to go to the hospital?
So certain things you should look for: definitely monitor his temperature, right? If you see his temperature for a few days is really running high, 101, 102, 103, it's going up and it's not stopping, you should take him to the hospital. If he's just not looking better to you, if he's looking like he's not getting better over some time as you're giving him fluids, take him to his pediatrician. That's a lot of people forget. We have primary care doctors which are very good at dealing with this stuff. And if you start off by taking them there, they can recommend and say, hey, we can watch him for a few days, or he should go to the emergency room, and we should go from there, and they'll really help further make that decision. But if someone's not looking good, don't hesitate to go and reach out for medical care.
Kira, good luck with your son, and I hope
Absolutely.
he gets better soon. That's interesting to hear that, because a lot of places have been telling people to stay away from hospitals. I guess.
Right. Well, stay away from the hospital if you can. Right. But if you're sick enough that you need to go to the hospital, definitely go to the hospital.
Doctor, here's another question for you. Is it safe to go outside if you have the flu? I was told that open fresh air is helpful. Is that true?
I mean, you can open a window and get open fresh air if you really want. I think the thing is, if we go outside and we go to restaurants or we go to the library, or we go to school, or we go to work, what we're really doing is exposing our colleagues, our friends and our colleagues. And a lot of people don't mean to do it. They want to tough it out or get that last day of work in. But really, if you still have that fever, you should really be staying at home. When you're sick, take the sick roll, get the rest, feel better, go out there when you're 110%. And trust me, our friends, our colleagues, they'll be waiting for us.
This year is worse than years past.
This year we got a strain called H3N2, which it's the vaccine is not as effective against, hands down, and it's a very hard strain to deal with. Part of that is all these hurricanes that we have had. They've really bought up the biome, right? So we have a much worse flu season this year, partly because of that. Again, that's why, but we have other flu strains out there too, right? So we still want to get vaccinated. We want to push vaccination all the way to help protect us against the flu.
And Debbie asking, I had the flu shot, but earlier, but with this flu round, do I need to get another one? And you said no. No,
absolutely. If you got one flu shot this fall, right, it covers you for the whole season.
What if you got it earlier in the season?
How early?
Like if you got it like September or October, like real early.
It still covers you. You can always follow up with your doctor, right? But generally, it should cover you.
Now, you talked about the higher dosage of the flu shot.
Sure.
Is that something that you should ask for, or is they typically targeted for folks with a compromised immune system?
Sure, absolutely.
Older adults?
Now, if you go to your primary care doctor, it's something you can talk about with them, and if they feel that you're a good candidate for that, especially if you have a compromised immune system, it's something you can discuss and bring up. It's really something your doctor will really cater towards you specifically, but it is available if you do have a compromised immune system. And what it really does is we attach the proteins onto what we call an adjuvant in medical terms. In layman's terms, it basically means you'll have a stronger response, so when the virus comes in, you'll have more hands on deck to go after it.
Okay, this might be an old wives' tale or something that my mom used to tell me when I was little about bundling up when you go outside. I have a teenage daughter who I can't get to wear a coat. When I drop her off at school, I see several of her peers also aren't wearing coats. Doesn't that make you more vulnerable, more susceptible?
I don't know if it necessarily makes you more vulnerable or more susceptible, right? But it's cold out there. Your kids should definitely be wearing coats. It definitely makes you more susceptible to some of the cold viruses. But that being said, if you get a cold, you can get the flu, right? So we should be wearing our coats, we should be wearing our scarves, especially on a chilly day like this in Baltimore.
Well, and it's really been tough, though, this season because, we've had a couple of days where it's in the 50s.
Right.
And then the next day it's in the 30s and we got flurries.
Right. Yeah, and it has been really, really going up and down. But, go out there, wear your sweater, wear your coat, bundle up. It's cold out there.
And we should see flu season wrapping up. Do we have to wait till it gets warm or when you get closer to spring? Or?
So flu season, we're in the height of flu season right now. We should see it start wrapping up around March. Flu, you can get that technically any time of the year, right? And I want to keep that in mind. The reason we get it a lot in the winter is because people are inside. We're in close quarters. It's cold outside. And we're more in contact with each other versus why we don't get in the summer or the spring as much because they're all over the place.
Okay. All right. Well, Dr. Faizi, thank you so much for coming in and answering our questions. We're trying to get answers to the whole flu situation that we're all dealing with right now. We're going to be back on Facebook Live coming up here shortly with more information where we talk more about what you can do to clean your homes and disinfect. Dr. Faizi, thanks again for coming in.
Absolutely. Pleasure being here.
We'll see you live on Facebook coming up here shortly.